Hello, and welcome to the AMA's Steps Forward podcast series. We'll hear from healthcare leaders nationwide about real-world solutions to the challenges that practices are confronting today. Solutions that help put the joy back into medicine. AMA's Steps Forward program is open access and free to all at stepsforward.org.
Hi, everyone. Welcome. This is Dr. Jill Jin, Senior Physician Advisor at the AMA, and I am your host for today. Today, I am joined by two guests, Dr. Adrienne Mann, Assistant Professor in the Division of Hospital Medicine at UC Health in Colorado, and Dr. Tyra Fainstad, Associate Professor in the Division of General Internal Medicine at UC Health. I'm very excited to be discussing with them a group coaching program they created called Better Together Physician Coaching. Doctors Mann and Fainstad, thank you both so much for being here.
Oh, thanks for having us.
Before we dive in, can you tell the listeners a little more about yourself and your background?
Sure. We are so thrilled to be here. I'm Tyra Fainstad. I am a primary care doctor and internist here at the University of Colorado. And clinically, I see patients. I'm also the resident director of the residents who have the continuity clinic in my clinic, and got into coaching maybe 5 or 6 years ago now, when I was solidly junior faculty, actually at the University of Washington, which is where I did my training in early facultyhood, and really found it through my own route of early career burnout, which I believe started pretty early on, probably early in medical training, when I adopted the sort of hamster wheel of what I'll call approval addiction that I think many medical trainees can resonate with. And by that, I mean, I got really good at the game of bolstering my ego or my sense of worthiness by other people's praise. Lots of things fed into this habit, but it worked really well for me in medical school. And I just continued this game through residency and chief residency, and then tried my best to continue it even into facultyhood when it became a lot harder. First of all, because I wasn't getting very many people's opinions anymore. We aren't evaluated as heavily when we're faculty as we are when we're trainees. And also, other facets of my life started to challenge these beliefs, such as having two kids pretty early on who were, in general, terrible objective feedback givers of me, and basically told me in their first year of life that maybe I was doing a terrible job. And so I really struggled, and I did what I think most early career physicians do. And I put my head down and tried to work harder to get out of these hard feelings of inadequacy or imposterism or doubt. And my usual game of working harder no longer was effective. And I found myself just questioning everything. Should I work less? Should I work more? Am I not being a good mom? Am I not being a good doctor? And I sought an answer to all of these things. I tried many different sort of quote unquote self care or even healthcare related solutions, and really felt lost until I begrudgingly agreed to a coaching session with a friend who was going through certification at the time. And I say begrudgingly because I very much did not believe that coaching was a thing. I was a allopathic Western trained MD. And at that time, coaching sounded to me like maybe a slightly fancier version of a cheerleader. But she was a friend. And so I agreed to a coaching session. And I am not overestimating this when I say that my entire life changed in that first coaching session. And I was hooked. And so pursued much more coaching and sort of got my head on straight around my identities as a mom and as a doctor. Really fell back in love with both of those roles, and especially with medicine and primary care, and came out of it with this profound sense of gratitude, but also a bit of anger that these pretty high yield and easy to transfer skills were not given to me in medical training, which leads me to Adrienne.
I just want to say real quick, it's so interesting that you bring up the young children or the toddlers, because we're always told to teach them, that self-worth comes from within and not to be motivated by external praise. And it's all these lessons that we know to teach our children and yet have trouble internalizing in ourselves sometimes. But yes, I have many follow-up questions, but yes, Dr. Mann.
Sure thing. Hi, everybody. I'm Adrienne Mann. I'm a hospitalist at the Rocky Mountain Regional VA Medical Center in Denver. I'm also an associate program director for our internal medicine residency program. I run our well-being curriculum for our residents here. And similar to Tyra, I came to coaching in kind of early to mid junior faculty times. I kind of had a similar trajectory as Tyra did. We actually went to medical school together, and I did my training at the University of Colorado. And I learned pretty quickly that, like, I'm an effective communicator and I can get people to like me. And I also learned that often other people's opinions of me could help me decide what to do, and that maybe I could make people proud or get opportunities based on how that worked. And so a couple years out of training, I was kind of chasing everything in every direction I could. I was trying to become a big E educator. I was taking on institutional leadership opportunities at the VA, and I was just really going what felt like 100 miles an hour, saying yes to everything that anybody ever offered me, because gosh, what an honor to be asked, right? And I had my second kid a couple years out of training and had some health complications related to that. And when I came back after a little bit of an extended leave, I just really didn't recognize myself in any of the roles that I was holding. I didn't know how I got there, and I didn't know if I could see myself in those things moving forward. And I was totally overwhelmed with the idea of coming back to any of that. But I did. I came back to a clinical role, and after having some postpartum depression treated and really getting some time back under my belt, I hired a coach to help me with for me, actually, I came to coaching because of some body and beliefs about myself that had been longstanding and challenging. And so I found a coach who helped women physicians with weight loss. And through her program, actually learned it was so much more than just about my body and what I ate, but really about the way I think about myself, the way I value myself and my opinions and my self as a human being. And I learned these same skills that Tyra was talking about. I learned that I didn't have to believe everything I thought. I learned that I actually might know what's better for me than everybody else might know what's best for me. And I learned that I could have known these things a lot earlier. And so, kind of, when Tyra was moving back from Seattle, we learned we were kind of doing the same things. And we thought we needed to build a program similar to what each of us had been through separately to help residents, particularly residents who identify as women, to deal with these themes that both of us kind of experienced heavily during both medical school training and early faculty. And so we thought, let's build a curriculum, let's study it and see if it works. And so that led us to Better Together.
Wow. I mean, thank you both for sharing those really honest and authentic stories. I actually think, I really appreciate that from the get-go, because I do think your stories are more the norm rather than the exception among trainees, women trainees, of course, but all trainees to some extent. And I really appreciated hearing that. Thank you. Before we get to the specifics of your coaching program, maybe let's just, in case anyone is not kind of familiar with the term coaching, as you mentioned, Tyra, in terms of what it actually is and how it's different from mentoring or, going to a therapist or talking to a friend. What exactly does coaching mean?
So, coaching is, first of all, really variably defined, and it's a term that is thrown out pretty loosely, especially in medical education. And so, one of my big passions is making that definition tighter and less flexible, I would say. I don't want to say rigid, but less flexible across the spectrum. Right now, you'll hear the term coach kind of used for what I would call really good teaching. Sometimes you'll use the term coach for what I would call mentoring, advising, and coaching is none of these things at its core, at least the way that we approach it in Better Together. So, coaching, or sometimes you'll hear executive coaching, professional coaching, certified coaching, is truly the act of guiding another person through their own brain and looking for roadblocks or self sabotaging thoughts that are getting in your way. And so it's exploring thoughts and feelings and actions with a question: is this serving you or not? And knowing that only the person you're coaching has the answers to that, that you as the coach do not, which is its main difference from all of our other roles. Where as in teaching, we have all the information and the answers, and we're just sort of disseminating that. in mentoring, we also have an idea of the direction we think the person should go. And in advising, it's even more specific, and we have a very specific piece of advice to give. All of those roles are super important. And both Adrienne and I also inhabit those roles in our lives as medical educators. And so I don't think that coaching is necessarily better, but I think it's a different tool to add to anybody's personal and professional growth. The other thing I want to say really quickly is that coaching is different from therapy or other mental health resources such as psychiatry or social work, in that it doesn't do any diagnosing or treating. So there is certainly overlap in these resources in that therapy also looks at thoughts and feelings. In general, we see therapy being used for people that are sort of not meeting their standards of activities of daily living. Sometimes we'll use a spectrum of -10 to +10 in terms of functioning or thriving. And therapy or other mental health resources generally is used for people that are in those deep negatives, getting someone from sort of -10, -5 up to 0. Coaching generally we'll see in the low, like -2 to 0, even in the positives, getting someone up to thriving. Now, there's a ton of overlap in there, and I think actually there's a symbiotic relationship between therapy and coaching, but I just want to point out that they're not the same. So Adrienne and I and all of our coaches in Better Together are very careful to say, in this program, we are doctors, but we are not your doctors. We are not offering any diagnoses or therapeutic advice here. We're simply exploring your brain with you.
Got it. Excellent. That's great explanation. Thank you. Okay, so Better Together Physician Coaching is your program that you created. And as I understand it, it's unique because it is an online group coaching program for physicians. Tell me more about the program.
Sure thing. So, in its current version, Better Together, we partner with institutions, departments, residency programs, medical practices, any group that's defined by the group itself, to bring this coaching program to their practitioners, so their clinicians. And that includes undergraduate medical education students, so medical students, graduate medical education trainees, residents and fellows, faculty and staff physicians, and also advanced practice providers. So groups can partner with us to bring this resource to their folks. Once that has happened, we offer our program to that population twice per year. And the program is a 4-month web-based group coaching program. And the cohort that the folks will participate in is a national cohort. So you'll be participating in Better Together with other people at that same training level, students, residents, clinical faculty, or APPs from across the country. And so we'll have large groups of over 1,000 people often who are all participating in the same curriculum at the same time. And in the course of the 4-month program, we first teach a metacognitive tool that's the foundation of our coaching. It's kind of like Tyra said, it's like the soap note for your brain. So I think clinicians listening will understand that, but we teach a tool that helps you think about your thinking. And that is the foundational tool of our coaching. And then over the course of the 4 months, we apply that tool to your relationship to the world outside of you, work, feedback, how to invoke a growth mindset. We apply that to the environment inside of you. That includes things like the imposter phenomenon. What does confidence mean to you? Perfectionism, approval addiction, and those things. And then in the final month, we apply that same concept to future thinking around what is the next version of you that you want to be stepping into, and how do you do that deliberately, managing transitions in your life, and finally in building self-appreciation and self-compassion. We cover all those topics in the 4 months, and folks can participate in a number of ways. We, of course, have live coaching that happens on Zoom, where anybody from that whole cohort across the country can join one of up to 4 or 5 calls per week that we have at varying times. And they can come onto the Zoom call, raise their hand, and come up and be coached in front of the group for about 10 to 20 minutes. We get through up to 4 people in a 1-hour session. And those people can bring anything for coaching that's going on in their life. So, hey, I just got an evaluation from my attending, and they said I'm not confident enough, and maybe this means I'll never be able to match in my desired specialty. So they'll bring that up for coaching, or someone else dealing with a new medical diagnosis that they're trying to wrap their brain around. literally anything. Those coaching calls are recorded and saved on a private podcast. We know folks are busy, so they can listen in later. They aren't able to attend live. So that's the first way of getting coached. The second is through written coaching. So we have a forum on our website where folks can type in, and this is totally anonymous. They write in about the problem they're facing, and we respond back with some coaching prompts. And that's on our website for everybody to read and learn from. Next, there's the self-study program, which is kind of weekly themes like the topics I shared earlier. We have workbooks that folks can work through at their own pace. And then finally, we offer one-on-one coaching sessions with our really, really incredible certified coaches. They are all clinicians, so advanced practice providers or MD or DO clinicians. And you get 4 30-minute one-on-one sessions over the course of the program. And so folks can really choose what of those pathways makes the most sense for them in getting coached. Some people really find, hey, the live coaching calls, that's where it's at for me. Others tend to prefer the one-on-ones or the written, and folks can really choose how to spend their time in the program. Nothing's required. We just offer it so folks can create their own adventure.
Yeah, I love that there are all these different options, and you're really meeting everyone where they're at, because of course, yeah, everyone has different time constraints and preferences of, speaking up in front of a group versus not, versus writing. So I really like that there's so much flexibility in how you can benefit, or how your clinicians can benefit from this. So it sounds like this program has really grown a lot since you guys have implemented it. So I do want to kind of go back and hear about the implementation itself, and when you guys came up with this idea through your own personal experiences. How did you take those first steps to implementing something locally? Any barriers that you experienced, and just getting started? How did that go?
Yeah. Back in 2020, when we discovered that we both wanted to start a coaching program for residents, neither one of us, and I think especially me, identified as a research person. So that was probably barrier number one, is that we desperately wanted to study this. We knew that this was going to be something that we were offering residents first, and ultimately wanted to grow to faculty in and out of academia, but importantly, addressing struggles in that academic environment. And so it was going to be very important to study it if we wanted to promote it within this environment that we live in, where sort of RCTs are gold. So initially, when we were building the program, it was early 2020. We pictured like fireside group coaching with maybe 10 or 20 residents in internal medicine, which is where Adrienne and I both are. And then the pandemic hit. And so we quickly pivoted to a totally digital format and built an online curriculum, and we offered it in the summer. We sort of recruited our first participants and immediately got slammed with really enthusiastic responses. And so maybe in that first day or two, we got 50 responses. Yes, I would like to join. And hey, have you considered opening it up to emergency medicine? I have a friend there who could really use this. Or what about peds? So we took a step back, decided to open it up GME wide here at CU. And because we had so much interest, we decided to go for it with a randomized controlled trial. So we capped ourselves at 100 that year because really we didn't know yet how much we could coach, and we didn't want to underdeliver. So we arbitrarily picked 100. Our biostatistician at the time told me, I remember this conversation, that there was no way 100 would show a difference, because if we were measuring burnout using the Maslow burnout inventory, the number that I needed was 500 to 600 in order to even show a 1 point decrease in the MBI. So we sort of said, oh, well, we'll just do this as a proof of concept and then we can scale it later. So we enrolled 100 people. We randomly assigned them to an intervention group, which got our coaching program in the spring of 2021, or a control group, which did not get the coaching program and was going to get it in the fall after the study was over. And then we delivered pre and post tests to both groups, looking at primarily burnout using the Maslow burnout inventory, also self-compassion, imposter syndrome, and moral injury using validated scales. And to our great surprise, we did show a difference in that pilot. So we were able to actually drop the burnout score, specifically this subscale of emotional exhaustion, in that pilot study by 4 points, We also improved imposter syndrome by a lot. We had an average curative reduction in that scale, and we improved self-compassion. So we were thrilled. What that said to me was we have a really powerful or impactful intervention. So despite, our small numbers, we were able to show these pretty big statistically significant results. In that pilot, we also did a qualitative analysis. We interviewed 17 participants asking, what was your experience? On our end, we were exploring why do we think this is so impactful. We found, unsurprisingly to us, that they really liked our coaching model, that metacognition, or thinking about your thinking. Soap note for the brain was something that they were using in and outside of sessions. And they also liked the flexibility of the choose your own adventure, nothing's required, show up when you can. Those were two major themes that came out. The third theme that did surprise us was they overwhelmingly felt a sense of community and brought that up over and over again, which was very surprising to us because we thought we had sacrificed community when we pivoted to a digital online model for pandemic reasons. But actually, they felt that even though they were never physically with these other participants, that they developed this enormous bond just hearing about their struggles and developing compassion for them, and then ultimately probably for themselves, being able to see themselves in these other people, which is, I think, the key to why our group model has been not only so scalable, but also more impactful than other one-on-one models that are studied around the country. Finally, we did a longitudinal analysis of this initial pilot. So we took that intervention arm and we surveyed them 6 months later and 12 months later after coaching had ended. We did not do a great job of collecting ongoing email addresses. And so, as you can imagine, we study residents, and many of them left the university during that time period. And so, our response rate was really small. And we certainly weren't powered to find a difference with that response rate. But even despite that, we actually did show a statistically significant longitudinal sustained effect for self compassion being improved in our intervention arm, which is so thrilling because truly our whole program sort of centers around building self-compassion, even though we don't say that very explicitly because doctors don't generally, doctors kind of shy away or think that it's not important, but it's very, very important. So that was the pilot. And one of the lessons that we learned from implementing the pilot was that actually creating the program and studying the program is a lot of energy and resources, but delivering the program is actually not. At that time, Adrienne was hosting one call per week and I was hosting one call per week. And we were managing sort of in our margins the ask for coaching requests that came in, but it wasn't too much more time than that to deliver the program. And so we felt at this point we had some interest from wonderful physician coaches around the country who were offering to volunteer coach for us. So we felt if we just bulked up our ratios of coaches to participants, this could easily be implemented. We can host a group call with like 30 people in the audience or with 3,000 people in the audience. And then we're impacting exponentially the amount of people, which is what led us to do the wild scale up of our 2022 multi-site national RCT, which was mirrored after our first one. It's now also published. Both of these are published in JAMA Network Open, and we enrolled over 1,000 residents and fellows from across the country, still in women only. That is because women are much more affected by burnout and all of these other outcomes than men. Actually, that year we also held a program for men, and now our program is co-ed. In that trial, though, in the fall of 2022, which again mirrored our pilot, we showed a statistically significant improvement in every single outcome we looked at. So across the board, everything improved, not only statistically, but also in a clinically meaningful way. And so we ended up being able to calculate a number needed to treat to take a physician trainee from burnt out to not burnt out of just 11, or from imposter syndrome to not imposter syndrome of just 9 from being in our program.
That's incredible. There are not many things in the world of burnout and well-being where the number needed to treat is single digits.
Right.
Wow. Yeah.
Right. I mean, even in the world of like heart disease or diabetes.
I just
Yeah.
think it is so great that you decided to do the RCTs and hopefully you'll, do the longitudinal follow-up as well for the 2022 trial. But I just think that the research is such a important tool because that's especially for those in academia, it's still what kind of gets those physician skeptics to buy into things. So I think that that's just great that you've done both the research part of it, but of course you have the personal anecdotes and the personal success stories to back it up as well. Is there anything that you still hope to see in terms of future growth for this program?
Well, that's a wonderful question. Thanks for asking. We would love to be able to touch and coach more people. I want to add one more thing, which is that Better Together is not an individual entity. We're a curriculum that's offered through the University of Colorado. And so, through partnership with our program at the University of Colorado, we're just really thrilled to be able to bring this to multiple places. I think we were at 44 or 45 institutions across the country over this past year. And so, what we really envision is being able to expand our reach to other departments, divisions, residency programs, institutions to bring this resource to their folks. And we know that coaching won't be for everybody, but that for those people who it resonates with can be a tremendously powerful tool. And so we think just getting this out to more people is our biggest vision for the next several years. We also envision and have started this year doing a type of coaching call that bridges all of those different cohorts that we run at the same time. So I told you that we have separate groups running for medical students, residents, and clinical faculty and APPs. But what we've started doing this year and are going to be doing more of in the future is having calls that intersect all of those groups that may have to address a certain identity among callers, or say specialty specific calls for folks at any range of training to get coached on themes that may be more applicable to that group. And so really creating more opportunities for community even across the cohorts is something that we're building in this year.
Got it. Excellent. I was also just thinking, I think another great part of this is that, as you're saying, kind of the time commitment isn't huge, right? The 4-month long course curriculum, and then the fact that you get sustained benefits. It's almost like it's an aha moment, I feel like, for many physicians probably, or it's one of those things where you really change the way their mind works, but it's not something you have like therapy or something else where you have to have ongoing, indefinite time commitment, which I think as a busy clinician, that's probably something that's very appealing to people as well.
Yeah. I mean, I'll just piggyback on that to say that something we have found over now 5 or 6 cohorts of doing this is that actually it is quite rare to be in Better Together and ever get directly coached, either on a group call or in a one-on-one session. What we know is that overwhelmingly our participants are mostly listening to the recorded calls or doing sort of asynchronous online work, either with Ask for Coaching or on their own. And those participants are still experiencing a huge benefit. And so you don't necessarily need to go have that really vulnerable conversation in front of everyone. Many do, and we're so grateful because it's those conversations. I always say it's like the courage of the brave few that is having this huge ripple effect for the more fearful majority to be able to see themselves in those conversations and then apply it to themselves. And so this program truly, truly was built for the busiest of physicians, residents working 80 plus hours a week. And it was built to fit into that lifestyle. And so it is very little is required to have the impact that it does. I think that's why it's so incredibly scalable.
Yeah. Yep. Absolutely. Are there any final thoughts? Anything you want to say?
If you had told me 5 or 6 years ago that this is what that I would be a certified life coach, that I would be involved in running national randomized controlled trials or a curriculum for thousands of people around the country, I would have said, "What are you talking about?" If you'd asked me in residency if this is what I thought I was going to do, the answer would have been like a hard no. Like I was going to be something totally different. And so I hope that people listening to this story can hear that, like, that crazy thing that you might have a tiny inkling of in your brain that, like, maybe could happen, could definitely happen. The other thing I'll add is that I think Tyra and I are an example of how partnership can really dramatically change the way you're able to impact others in your work. And so I absolutely couldn't have done this by myself. I know Tyra doesn't think she could have done it by herself either. And so finding somebody to collaborate with can just be so powerful. And so though I couldn't have imagined this being my life, I'm so, so happy that it is. And so I wish that for everybody.
I can't say it any better than that. This program truly, I think Adrienne said this years ago, this program is a gift that feels like we built for our prior selves. And we are so thrilled for anyone who wants to enjoy it now. If anyone has questions, please don't hesitate to reach out. We're always happy to come talk about coaching.
Well, thank you so much for joining me today, Drs. Mann and Fainstad. And as always, we will link the resources mentioned in today's episode in the episode description. Thank you. Again, this was such a great conversation. And I feel like I've gained so much from just having it today.
Oh, good. Thanks so much for having us.
Thank you.
Thank you for listening to this episode from the AMA's Steps Forward podcast series. AMA's Steps Forward program is open access and free to all at stepsforward.org. Steps Forward can help put the joy back into medicine by offering real-world solutions to the challenges that your practice is confronting today. We look forward to you joining us next time on the AMA's Steps Forward podcast series. stepsforward.org.